Hey, what's up, everyone? It's Dr. Glenvo. I am super excited. I've known of this gentleman for quite some time. I've known of his business for quite some time, but it wasn't until baseball, right? Baseball, sports brings people together. It wasn't until I was at his Orioles game that they were playing the Reds. And honestly, at that time, if you guys are following baseball, Orioles are red hot. But at the time, they weren't that red hot, right? But this guy, like a true fan, even though it was a good game, but they ended up losing it. Even though they lost, he was a true fan. But I got a great chance to know Harold Gornbein. He's a partner. I would say he's the main guy, but he's a humble guy. He'll say he's a partner of Apex Reimbursement Specialists. Harold, welcome to the podcast.
Hey, Dr. Well, thank you so much for having me. And even though the O's didn't win that day, you and I still had a winning conversation, so I appreciate that.
We did. And so here's the thing. I've been wanting to get you on here because number one, Nifty members have been bringing you guys up. So it's like perfect timing. But I would say you guys are like the OGs, like literally the OGs, the originals when it comes to reimbursement. And for those who don't know you guys very well, right? Maybe, we have a lot of new dentists, new practice owners. They're feeling their way. They're trying to figure out things. They haven't been around the block like me, and I know all the big major players. But for those who don't know you guys, Apex Reimbursement Specialists, what do you guys do? Number one, and then number two, how long you been doing it? Because that's the big thing. Like it seems like every day, Harold, every day, it's kind of like AI companies. It seems like there's a new company every day. And when it comes to RCM, reimbursement, anything insurance related, seems like there's a new person every day, right? But you guys aren't new. You guys have been around the block. So give us the elevator pitch of who you guys are. And Harold, yourself, how long have you been doing this, man?
Well, I'd say I appreciate, the intro and appreciate the value. And I guess I don't want to date myself too much, but OG, I think is probably the right term. I mean, I come from the insurance before Apex was started. I was on the insurance carrier side. So I was on the dark side for 25 years. That really dates me. But Apex, we got started back in 2012. So I think in our business, that is the OG world. And when we got started, it was kind of started by accident a little bit. One of my partners now, his cousin was a periodontist down in Miami who called him one day and he says, Joe, I know you negotiate stuff. Can you help me with my insurance contracts? I'm unhappy with the insurance companies are paying me. So Joe, we didn't have Apex yet, but we were sharing office space. And Joe says, hey, I know you've been in the insurance business a long time. You're in the dental world. You understand it. Hey, can we help my cousin get some increases? I'm like, let's make some calls. Let's write some letters. Let's work on it for him. We ended up getting his cousin some nice increases. And we looked at each other and said, maybe we have a business. So Apex was born 2012, kind of by accident, which a lot of great businesses are. But since then, again, OG, it is a long time ago, from 2012 till now, we've touched about 4,500 practices or so across the country. Wow. We've impacted about $1 billion worth of revenue on behalf of our clients. But I'll tell you, when you spoke about earlier, hey, reimbursements, RCM, there's so many different things in our world that can help these dental practices become better businesses. And I know you help practices all the time. So even though we got started in fee negotiation on behalf of our clients to help generate more revenue for their businesses, clients over those years have asked us, what else can you do? What else can you do? So what we've done over the years, the last 11, 12 years, we've added credentialing management. We added helping them set their UCR, their cash paying schedule, helping them analyze that because that's important. Clients have said, hey, can you do our dental billing? Can you battle denials? Can you help us with the claims that are denied and help get us paid? So we do all that as well. Other problems like insurance verification. Their staffs are having a hard time being on the phone all day with insurance companies. Over the years now, since 2012, we created an organization and a suite of services that help dental practices become more profitable, be more efficient, but help that front office staff focus on the patient, leave the insurance world and that frustration. That's where we help them.
Something that you told me when we're at the game, and you told me that it was just like it made so much sense, right? It's kind of like, dentistry is like one of the few professions where the practice owner has to kind of be like almost like a jack of all trades, right? You got to be a good clinician, got to be a good business person, got to be a good leader, got to be a good negotiator, got to be someone who's kind of knows a little bit about HR and kind of knows a little bit about, customer service. You might need to be the guy that fixes the AC sometimes. You might be a handyman. You got to do all these things. And there's other businesses out there that's comparable, other small businesses with the same type of revenue, but they have so many different specialists, right? Like again, if you go into a restaurant, right, and the manager or the owner, right, the owner is not walking people back and sitting them down. The owner is not ordering like all the ingredients. The owner is not like also cooking, also making drinks. I mean, some are, but those restaurants are poorly managed where they're doing all those things. So again, dentistry is so unique that the amount of revenue we bring in, we're doing so much. So again, I want to go back to you, Harold. Well, what you were telling me is that sometimes when you're trying to do everything, you let things fall through the cracks. And one thing that you said that people let fall through the cracks, and we don't even think about, is making sure we're charging the right amount, right? So talk about that. So again, like we don't even think, we're thinking about like, I'm trying to fight the insurance company. I'm trying to fight all these battles. And then there's something right in front of our faces like, well, how often do you adjust your prices? Because I don't know about you, Harold, but the other day I got a little notification that some streaming services, they raised their price. And I was like, I looked at it, kind of said a few words, shrugged my shoulders, and just moved on with my life, right? Yet we don't, everyone else does it, but we don't do it that much. So talk about that. Talk about how dentists, like, we're in this weird situation where we're doing all these things and something as simple as our pricing, we drop. And how much are we losing? How much are we leaving on the table when we do that?
Well, loaded question, but it's a great one. And you're right. You're, as a dentist in your practice, it's the busiest little business out there. There's so many things you could be doing. People are so focused on supplies and labor costs, all these different things. They often forget what they're charging. Like you say, they're cash paying fees. They may even take a lot of insurance, and they think, oh, I'm getting paid what insurance paying me. They do forget about that percentage of the population that they have in their practice that are self-pay, that are cash paying patients. And they're worried about adjusting those fees every year and really analyzing that, because they're worried that these patients are going to go down the street to another dentist if they change their pricing. Based on our experience, that's not the case. We would advise our clients all the time, and we would tell you that, you know what, every little dollar makes a difference. And if you analyze your fees and you price them, we're not saying jack them up what they higher than they should be. We're saying don't keep them as low as you have them,
Yeah.
and don't be artificially low. We want you to be priced right for your market. So for example, based on the average practice we see, about 25% of the revenue is just cash self-paying patients.
Mm-hmm.
So if
That's a
you think about
lot.
it, that's a lot of revenue at the end of the day.
Yeah.
If you haven't adjusted your fees in 2 years, 3 years, 4 years, really haven't looked at it based on what we see typically, you're probably losing out on a good 10 to 20% of your revenue just by adjusting those prices to market conditions. That's number one. Two, if you ever try to negotiate with insurance companies,
I was going to
it's
bring that
very
up.
it's very hard if you're not putting upward pressure on those insurance companies through your usual and customary fees. The insurance companies are saying, hey, we're giving them great fees. Look at their UCR is down
That's what I was going to
here. Like,
say. Doesn't that insurance company look at your UCR, and they're like, "Hey, look, I mean, what are you coming to us for? This is what you're charging, right? We're just giving you what you want."
it's such an important point that you bring up, because they see the claims that you submit every day. They
Yeah,
know what you charge. They know what your cash paying charge is. So like you say, let's say the market rate's $100 for a procedure, and you've charged $75 for the past 2, 3, 4, 5 years. The insurance companies are reimbursing you, let's say, I don't know, $60. They're like, hey, we're only discounting it like 10, 20% off their usual and customary. I'm like, well, that's artificially way too low. We
yeah.
need to help dentists know that, one, they just need to price appropriately, actually look at the fees, because we want to put upward pressure on the insurance companies so they can get some negotiated higher rates. but also all as I mentioned earlier, that 20%, 25% of the cash paying patients, you're getting paid for the work that you do, and you're getting paid appropriately and not gouging, nothing, just market conditions. And if you think about that 20, 25%, you look at the average, let's say a practice is doing $1 million a year, something like that, and you're doing about 250, 1,000 of that, just self-pay cash. If I'm saying that you might be 10 to 15, 20%, that's $25,000, $50,000 you're not getting as revenue in your practice.
And you're not doing anything different. You're doing the same thing, and you would get an extra 25 G's, 25 to 30 G's by just doing. And again, like for those who, I get it. I used to be one of those people where I'm like, I don't want to raise the price. I feel bad, blah, 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 blah. The thing is this, okay? Your streaming services, anything else, the airlines, no one cares. No one cares about your feelings, right? They're doing it. They understand things are going pricey. And honestly, if you think the guy down the street didn't raise their prices, they probably are too. And they're doing better and they're doing really well. And you are still stuck there, right? Like your patients aren't going to leave you. If they're going to leave because you raise some prices there, and to be honest, they're probably not even paying attention to it. But let's say they're leaving, you got other problems, which Harold could help you with. He can.
No, 100%. We're talking, at the end of the day, we're not talking about going from a $50 procedure to 100. We're talking about rate, the market, let's say you're charging 50, the market rate might be 55. If a patient leaves you for $5, like you said,
got other problems.
Something else isn't right. So
now I want to bring up something that was really important, because it's one thing, guys. It's one thing to have knowledge, right? To have the system. It's another thing to actually execute, right? And I bring that up because you may be thinking like, oh, okay, I'll raise my fees like 15, 20% or whatever, right? What I love about what you guys do, Harold, over there, not only working with negotiating with the insurance, because let's be honest, the best person, right? Look, the best CPAs are the ones that used to work for the IRS, right? Like they know how to make sure you don't go to jail. And I will say the best people who deal with reimbursement are the ones that used to work for the dark side. Somebody here used to work there. But anyways, the best people, right? And so, Harold, why is it important to work within a professional, like somebody, whether it's Apex or anyone else, who knows what they're doing when it comes to adjusting your fees? Why is it? Why can't you just randomly like, let me flip a coin and 25%, I'm just gonna raise my fees?
No, I think what the key thing is, it's understanding what the fees in each of your markets, not just in your own little practice, but in your market. And we're looking at data from many, many practices in your market. So you got to be real specific and diligent and analyze according to the market, not just by what you think. Your point, Glenn, is a good one. I was speaking to a client yesterday, and we were talking about the UCR. It's such a big point. She said, "Oh, we just increased these fees a year ago." And I said, "Well, how did you do it? What was the data they used?" We just kind of penciled it in, like changed it a few points here. Well, how do you know if you did it enough?
Yeah.
So we want to put our clients in the position that they're priced appropriately based on data, and data is thousands and thousands of claims that are going through the insurance companies and
that you guys deal with all the time, that you see
all the time by the market. So that's our business. We're living in those benchmarks. We're living in those numbers, and it's no fault, like you said earlier, the dentist is running this busy place and there's so much to do. They're asking a lot of the front desk. The front desk is multitasking a lot of different things, and they say, what do they say? I don't know, kind of you're multitasking, but like a master of none. I don't know. The phrase escapes me, but I think for anybody's business, if I want a great crown fitting, I want a great anything in dentistry, I go to the dentist who's great in that market, who's a specialist in that space. Same thing in our world. I would go to who knows the market best, because ultimately we're here to improve the practices. It's what we focus on every day. But data and understanding the market is so critical.
100%. So, normally I like to get my guests to make some bold claims and some guarantees later in the podcast. But I just feel it's like appropriate to kind of like get you to like say something here, right? So I'm going to throw out some parameters, right? I'm not going to throw you under the bus or anything like that. We're friends, okay? But let's say someone who's watching right now, which I know there's a lot that are watching right now, and they haven't adjusted their fees in 3 years. Let's just say 3 years. Let's say 3 years. they haven't adjusted their fees in 3 years, and they haven't even talked to the insurance company about any kind of negotiation within three. Let's say 3 to 5 years. Okay. That person, if they come to you, would you feel comfortable giving them a guarantee that if I work with you, you haven't done anything in 3 years, adjusted your fees, or even talk to an insurance company? Would you feel comfortable saying, guaranteeing that you work with me, you're gonna get that $25,000 that you've probably been missing?
Well, I'll tell you, 25, that would be an easy one. We can go with the 25, but I'll tell you, I'll give you the example like we spoke about earlier.
Okay.
I break it down for our clients all the time. And based on the amount of information we see and data we see, I have a pretty good feel for what the average practice does. But let's just use the $1 million one. Yeah. The $1 million practice, I believe 30% of it is 30% is cash. The other 700 is insurance. And we don't like to give people blue sky where blue sky doesn't exist. We want to be really conservative. Sure. And I know you put me on spot guarantee, but I'm going to.
But that's why I said 3 years. That's why I said 3 years instead of someone wuu anybody. I would say three because I would think like if you haven't adjusted your fees in 3 years, based on what you told me, things have gotten a lot more expensive.
No, I feel real confident in a very simple math. I see this every day, and I help clients with it every day. It's at $1 million. Their cash is 300,000. I believe there's at least another 30,000 or so on the table they're leaving, and we've got to get that going. In the insurance world, about 700,000 of that revenue left is insurance business. And I'm going to say, we can impact. Let's talk about half of that. Let's talk about 350,000 worth of that revenue. Our average increase is about 8%. So 8% on that 350 is probably another 27 grand. So 27 plus your UCR. I think if somebody's doing $1 million on average, they haven't touched anything in 3 years. I think if they come and say hello to us, they're probably got another 50 grand in
50 grand
opportunity for sure. The additional point, which I think people don't necessarily pay a lot of attention to as well, UCR is important, negotiating is important, but understanding the procedures that they're doing. We do an analysis on their production by code report. We know when I ask you for a 12-month production by code, it paints a really nice picture of what we're doing, but also what we may not be doing. So I may come back to you, doctor, and I say, you know what?
You're not billing out for something?
What?
Maybe they're not billing out for something. They've been just doing it, and they didn't realize that's actually a code or something.
It could be they're doing the work, but they're not submitting the bill for it. Because I would say, hey, I noticed you're doing a lot of, let's say a lot of 180s, but I don't see this 43401. I don't see this perio code being billed. I'm like,
yeah.
I don't understand. Or I'm seeing a lot of 4341 perio codes, but I don't see a lot of 180s being billed. You're missing out on a lot of revenue, potentially one that you're not billing for. I mean, I don't know about you, but I speak to dentists. I mean, I know you do. I speak to dentists every day. I'll say, well, tell me about what you're doing. They'll say, well, I'm doing this, this, and this. I said, are you billing for every single one of them? Well, the insurance company is not going to pay for it anyway, so I'm not even submitting the bill. I'm like, no. Submit for all the work that you do. Make an effort to get paid for everything you do. So that coding analysis report is very important to understanding, are you submitting for all the work that you do? But also it tells a picture of if I'm doing a certain utilization of a certain code, based on our understanding actuarially of the codes utilized by each dentist, it tells us this other code should have already been submitted multiple times. And if we don't see it, I'll say to a doctor, hey, I don't really see any 4341s. Well, we send it out to the periodontist. That could be they send it out to a specialist, but that gives us an explanation. But I'll say, well, of that, how much do you think you can do in-house? You're not doing it. You know, we're also helping them find opportunities for additional treatment that they may be missing out because they're used to practicing a certain way every day. If they're open to being coachable, we can increase our fees for sure. We can negotiate for sure. But we could also help them probably do more dentistry in a practice they may be
probably be more efficient too. I always tell people like you only know what you know, right? Like, I mean, again, you learn things, you make mistakes, you learn, you talk to people, you work with companies like Apex and work with Harold, and you learn, right? But the thing is that unless you talk to someone, unless you go through it, you only know what you know, right? So again, I love this now. Where I'm going to shift gears here, and guys, we'll have a great Nifty deal here. It's going to tie into kind of what we just talked about there, because Harold's been doing this for a while. We've already established that. He can take a look at what you guys are doing, and he'll know, like, okay, I think I'm comfortable saying this and whatnot. And that's what I love, right? Like that's what I love about working with Harold here is because he's not just going to throw out some arbitrary thing. Like he's been through it all. He'll give an honest assessment. But I want to shift gears here and talk about, there's other companies out there. When someone says they deal with RCM and they do with verifications or they do all this stuff, like they say they do a whole bunch of things, but they really just do one thing, right? Or they do a couple of things. Maybe the guy that says, I help with your insurance, but all they do is verification. Or hey, I help negotiate your fees, but not really. So again, what I notice about you guys is that I look at your menu of services, and guys will have the link in the comments. But you guys do revenue optimization. We kind of talked about that. Credentialing, which again, that's huge because you didn't get your credentialing right. You're probably not going to get paid the right way. Then you work with transitions, acquisitions, startups. Again, those type of things are a little different for everyone. We talked about insurance verification, dental billing, and then clinical compliance for those who are like have multiple practices. What if you the owner is going around just look at everyone's chart? Good luck. You're not gonna do that, right? That's you're gonna do that for a month and you're gone. But Harold, talk about all these things. Why do you have all these things in house, and why does that make Apex different?
It's really an excellent point. You summarized it really better than I can, but I'll tell you, like I said, when you mentioned earlier when we started the podcast, being the OG in the industry, it's really true. And in our industry, and I'm sure the viewers and the listeners to this podcast realize the industry's gone through a lot of change. Insurance reimbursements, revenue cycle management, getting paid has just gotten more complicated, more convoluted over time. What we have found for us, and I think the reason what sets us apart is as the industry has grown, the complexities have grown. We have upped our game and added more services into what we do to help our clients. And the reason why we've added all those different services that you've mentioned, it's specifically because of the needs of our clients. Over the years, they said, hey, especially during COVID, they lost their front desk person and nobody submitted claims, like we need help. So we had to create a dental billing division to help them submit these claims. We're at the stage today as we understand what the insurance companies are looking for, whether it's through the data you need for negotiations, whether it's insurance verification. I mean, I'm sure your folks can speak to this on the phone, or excuse me, on the podcast can speak to it. You probably have comments. I'm tired of sitting on the phone for 20, 30 minutes.
Oh, yeah. Yeah.
We've created some technologies that we cut that 20 to 30 minutes down to, let's say, 2 or 3 minutes, makes our team much more efficient than the average front desk person. But setting us apart is we've really evolved as the industry's evolved. We've evolved along with it and have really upped our skills and our service that we offer our clients because we want to help them. We want to help them become better businesses. And instead of having one company over here do one company over here, what we've really challenged ourselves is bring on the right people on our team to satisfy the needs of these practices. So what I think sets us apart, in addition to just evolving and becoming more knowledgeable about the industry and evolving these services, all the services we provide are all done by our employees. They're all W-2. We're not farming it out somewhere, someplace where you don't know the people you are. When you speak to somebody at us, whether it's our a revenue optimization team, or dental billing RCM team, or insurance verification team, you're speaking to an Apex employee, in-house W-2, not outsourced. They work your hours, and they're skilled. They're very experienced. And this is what we do every single day. So I think it's kind of some little piece that set us apart there.
I love that. And I love the fact that, look, guys, I mean, Apex has been around for a while. We already established that. And honestly, back in the day, there wasn't a bunch of companies that did this, and this. I mean, it seems like out of necessity, you guys had to develop this in-house, and then you just realized that when you keep things in-house, it's a lot easier. Communication is a lot easier. So, like, again, if you're working with a practice owner like myself, and I have a question about something else, you know exactly who's doing it. You don't have to pick up the phone or tell me to call this other company and whatnot. Again, all the clients that have switched over to you guys from other companies, how's that benefited them? Where they used to have to piecemeal that out. Maybe they were doing some of this stuff. And how often do your clients who, before they're like, hey, I'm just coming to you and I just want insurance verification. How often is it that clients are like, you know what? I'm just gonna let you do this, man, because I'm better at being a dentist and not an insurance specialist.
It's so true, because in our business, as you go through all the suite of services we offer, they're all connected.
Yeah.
They're all a piece of that puzzle. So if you have somebody doing this over here, somebody's doing this over here. Those folks aren't communicating. They're separate companies, they're separate worlds. Ours are all people that are working together for the benefit of this practice. And so you think about it, probably a lot of your podcasters probably own one practice, a few practices, maybe some good sized groups.
Yeah.
Then you have these really large groups that invest a ton of money in these admin call centers that are very expensive, multiple employees. The average solo practice, small group, even small, we'll call DSO, may not have the ability and the economics to do that, to hire all these experts. But for us, we built a team to empower and utilize the leverage of these large groups for the average solo practice, small group, small DSO. We're giving them that same expertise that these multi-million dollar groups have. We have it all in a one-stop shop and offer.
I love it. I love it. I mean, that's the reason, guys. That's the reason why I brought Harold on, right? I got to know. I spent like almost 3 hours talking to the man in between like exciting hits and stuff during the game. But I talked to him, and what I realized is, look, guys, I mean, the large groups, the large DSOs, they have a designated team that does this stuff, right? A designated team. Like the office doesn't even do it. They have corporate doing it. And even like even like a mid-level, they probably have something to do that. But for us single practice owners, we're having our team do it. But you all know that our team's already busy. You're busy, right? Your team could be doing something more productive. Why not have Harold's team, which is they do this all day long. They've been doing it for 30 years. They do everything. Why not let them do that? So with that being said, it's time for the arm twisting, right? I told you there was going to be some arm twisting involved because you're on the Nifty Thrifty Dentist podcast. And whenever you come on this podcast, we always want to know, Harold, you got a deal for us? We want to try you out, right? We want to see what you could do. But you got a deal for us, right? All my community, all the listeners, they normally come on because they want to know, okay, I can use this, but is there a deal? Is there like a promo code? Is there special? Is there something? So Harold, I'm going to put you on the spot. What can you do for our community of over 50,000 dental professionals?
No, I'm excited. I really appreciate you and I appreciate your community. As I mentioned earlier, the single service that I think it has a quick impact, but you need a lot of expertise, and that's helping set your cash paying fee schedule. That usual and customary and reasonable chart, those fees, we will perform our analysis for all your listeners, all your participants in Nifty Thrifty, all your participants. We're not going to charge them for that. I know Glenn will put a link in to get in touch with me and our team. We'll work on that for you. No charge. The matter of just building a relationship, saying hello. We're here to impact is efficiently and really deliver great value. The goal is, and I think there's a lot of low-hanging fruit for your listeners out there. That service is normally a $350 charge for your members. They reach out to us. We'll conduct the full analysis for them.
Dude,
We're not going to shortchange them at all. We're going to do a great job and hopefully impact their practice very, very quickly.
I love it. So look, guys, I mean, look, Harold, he wants to work with it. He wants to work with our community. He told me, he was like, look, I love what Nifty Thrifty is about, right? We always want to, save money and grow our businesses. I mean, that's what he had to do with Apex as well. So he understands, he's been there, and honestly, he's still kind of there in a lot of things in his business, right? So look, guys, he's going out on the limb, and all I'm asking everyone, for those who are going to take advantage of this deal, right? Take advantage of the deal, talk to them, ask them questions, ask them to look at what you have in your practice. What other low-hanging fruit is there, right? Because again, Harold's very thorough, him and his team. I met his team, and here's the thing. If they feel like there's opportunity, why not, right? Life is too short. You're too busy. You got other things to do. You're trying to learn how to do the next dental procedure. You don't have time to figure out the nuances of the insurance. And honestly, unless you're an insurance like a specialist and fan like Harold, why would you do it? You'd rather, if I were you, I'd rather go watch a baseball game than try to figure out the insurance stuff. Heck, you know what? If I get enough of you guys, maybe we can all watch a game with Harold, right? Who knows? I'm throwing it out there. But Harold, dude, thank you so much. Before we log off, any words to the community? Any words to any dental practice owners who's considering? Is like, you know what? Kind of like this guy. I want to see what he can do. If they're kind of thinking about it, what's your words to them? What's your words to them? What's your message to them?
Over the years, the biggest piece I've always left off with prospects and clients that we've worked with is If you do nothing, you do nothing. If you're happy with what you have today, hey, we shake hands, we're good friends, and now you just have what you still have. But just like anything, you go to the gym, you do all kinds of, you want to improve yourself. Improving yourself is like, and improving your business is like improving yourself. If you don't do anything, you're going to be in the same place. So my biggest guidance for you is, one, take advantage of everything that Nifty Thrifty brings your way. And we appreciate our relationship. That's why we're willing to commit and stand behind offering great value to the listeners. But if you do nothing, there's what they say, no pain, no gain. Here, it's not even, there's no pain. This is just, we're working at gaining and improving your practices. And that's my biggest guidance.
I love it. I love it. So look, guys, take advantage of this deal. We'll post it there. If you're curious about what else they do, look, I mean, you can go to the site, but I challenge everybody, just give them a call. Because again, like, I thought I knew a bunch of stuff until I sat down and talked to Harold. And honestly, I met his other team. They know their stuff. So reach out. So Harold, thank you so much for jumping on, guys. Thanks for tuning in. Make sure you call them. Make sure you hit that link. Tell them, hey, I saw you on Nifty Thrifty. I want to get that special deal because we got that special deal. And then once you guys love them, you got to come back and let everyone know. Okay, that's another thing too I got to throw out there. So Harold, thank you so much, my friend. And guys, thanks for tuning in. We'll see y'all next time.
Have a great day. Thank you so much.